Well, welcome to day 6 of our Next Generation NCLEX 7-day training. We're almost done with this 7-day training, but I want to make this day very special. All right, we put the notifications here, silence. There you go. So I want to make this day very special to you because I want to put everything together. Everything we've been discussing so far from day 1 to day 6, I want to put it all together in a case study. And it will be our second case study of our 7-day training. As you know, we already been gone through day 1, day 2, day 3, day 4, day 5. Make sure if you're here for the first time, if you're watching this 7-day training live for the first time, make sure you go back to day 1 to day 5 so you don't miss any of the valuable information that we have provided, because if you don't, you're probably gonna be a little bit lost, and I don't want you to be lost. Today, we're gonna cover our second case study, and it's going to be a very interesting one. So wait until that time when we get to do the case study, because it's going to be it's going to make a drastic change in the way you see these NCLEX style questions. It's going to be a drastic change in the way you're going to see the next generation NCLEX. So I hope that this training has been very beneficial to you, that you're no longer in fear for this new NCLEX coming up in April 1st, 2023, and that you know that you have the ability to pass this test successfully. As always, at the end of the presentation, I will continue to give free access to 3 nurses that are here in our YouTube training that have subscribed to our registration form for the membership raffle. So if you haven't done so, find it in the comment section, find it in the description section in this video so you can register. And of course, make sure that you are subscribed to our YouTube channel so you don't miss any of the valuable information. And like always, I ask, like this video. Everyone in this live presentation, like this video, because I want every nurse out there to see this live presentation. Since day 1, we have been discussing 6 clinical judgment measurement model cognitive skills that you need to develop in order to be successful in the next generation NCLEX. And it is recognize cues, analyze cues, prioritize hypotheses, generate solutions, and take action, which is the purpose of today's training. Now, in today's case study, we are going to cover each one of these 5 steps, because the last step, the evaluation outcomes, we will not be covering it today. We'll cover it tomorrow in the case study that we will be doing tomorrow. So let's talk about take action cognitive skill. It is a cognitive skill that involves the nurse performing appropriate and necessary intervention based on the client's situation and generated solutions. As you see, it's a systematic approach. The necessary nursing actions can be those interventions that prevent health problems, maintain client stability, improve the client's condition, prevent complications, management of an emergency situation, and so on, preventing a patient from deteriorating even further. So that's what take action means. What can I do as a nurse to help the patient with the problem that the patient has, or how can I do something to develop further complications? How do you know what actions to take? How do you know what is the most important or appropriate action to take? Well, once you have gone through these steps, step 1, 2, 3, 4, once you go through that step, you need to ask yourself, well, what is the client's priority health problem? And think about factors that could impact the decision that you take. As an example, what is happening to my client? remember that in these clinical scenarios, they will be giving you a bunch of distractions, a bunch of no sense, nothing that makes sense, nothing that is really important in order to make a decision. So that is important to know, that they will provide relevant, valuable information, but they may put some information there that is not really that important. Identify what needs is the priority. What do you need to prioritize? What do you need to do to address those needs? What is the goal in the care? What is the goal in your nursing interventions? And also, what do I need to do to prevent complications and clinical deterioration in the client? So these are a few questions that can go through your mind, and we will see an example of how you apply this in an actual NCLEX question, because when you read it right now, or when you listen to me, it might not make 100% sense until you see an example of how this information is applied to a next generation NCLEX style question. So what type of items will I see or will I need to take action in order to select the proper response? Well, in drop-down questions, in multiple response, multiple choice, and drag and drop style of questions. In today's training, the first style of question that we will be discussing is the drag and drop rationale. We've spoken the other training in the previous days about the drag and drop clause. We covered some information about the multiple choice single response and the matrix response. We also saw select that applies, select and, multiple response grouping. So we've covered a lot of these style of questions in this 7-day training. If you don't know what I'm talking about, you have to go back to the previous days. Once again, I'm not saying this to be to annoy you. I'm saying this to help you. It's not about give me a view on YouTube. It's about really understanding what the next generation NCLEX is about. So let's see an example of a drop-down rationale practice question. So as I read this scenario to you, make some notes about what do you think are important keywords, what are valuable information that you need to remember to answer future questions. The scenario states, the home care nurse visits a 79-year-old client who was discharged from the hospital 1 week ago for treatment of heart failure. So far, I can identify of important information. The 79-year-old patient has a history of heart failure and was discharged from the hospital 1 week ago. So that is important information. The client tells the nurse that the exercise regimen of walking 3 times weekly was started, but feels extremely fatigued the day after walking. You see, any information provided by the client's statement, you need to put it like very important, because in the client statement, they will identify the most important information. So what is the problem so far? Apparently, there was a regimen of walking 3 times per week, according to the doctor's order. The patient followed the order, but now says, I feel extremely fatigued the day after walking. And why is this important? Look at the next sentence. The client has avoided walking this week because of feeling so tired. So what is the importance about the patient's statement? That originally the patient was following doctor's order, walk 3 times per week, but now decided to stop following doctor's order. So that is extremely important. Avoided walking this week. That's important. The nurse gathers additional data and documents the following. So the nurse did an assessment, took some vital signs at 11 o'clock. Temperature 98.6, normal, heart rate 68, normal, respiratory rate 20, borderline high at the maximum. SpO2 92, a little bit on the low range, but still normal. BP 112/68, normal. Lung sounds are clear, bilateral, no peripheral edema. Sleeping well with 2 pillows for head elevation, and up to the bathroom to void once nightly. So as you can see, when you look at the whole scenario, the most important information provided on this scenario was the client's statement, because on the assessment and vital signs, nothing really significant popped up that made you extremely worried. So let's look at the question now. Let's look at the drop-down rationale practice question. In this type of question, they will usually give you a table and they will give you 2 options, and these 2 options you have to combine them. An example says, complete the following sentence by choosing from the list of options. The nurse would option 1 because of option 2. What does that mean? You have to complete the sentence. The nurse would pick up one of the answers in option 1 because, and pick up the actions in option 2. So let's look at the answers. Answer number 1 says, advise the client to slow down on the exercising. Number 2 in option 1 says, inform the client to maintain the same exercise regimen. And the third option is, instruct the client to check the amount of ankle edema before exercising. Well, what an interesting scenario. Because if you conducted the first step of recognizing cues and analyzing the cues, you can really determine that the most important information provided on the stem of the question was that the patient decided to stop the regimen because it was difficult for the patient to complete the 3-day walking as advised in the stem of the question. So I think I can eliminate the last answer because it doesn't really pertain to following or not following or modifying the treatment that was given to the patient. So the last option we are going to eliminate. Now we have this option. Let's call this option A, and we have a B option. So let's call the second option B. That way you can tell me in the comment what is your answer. Okay? So tell me if A or B is the answer. I know that I see some of you already selected answer what would have been C, but we can eliminate that one with the information that I gave you. So between A and B, if we know that something is going on, that it is affecting the client's ability to complete this order the right way, would telling the patient B, inform the client to maintain the same exercise regimen, does that make sense? B doesn't make sense because the patient already is telling you that cannot complete this regimen with the way it is ordered. Also, what is the relationship between A and B? They are opposite, so you can use that strategy. If you were stuck in between A, B, and C, I'm not sure, use that strategy, the opposite answers. Usually when 2 answers opposite each other, the correct answer is in between those 2 answers. So A or B, they are opposite. What are we gonna do? A. A is the correct answer. So we have already completed the first part of the question. So now we know the first part. The nurse would advise the client to slow down on the exercising. Now let's find option 2. Because what? Because the heart needs to contract efficiently and exercise is one treatment measure to accomplish this? Or the nurse would advise the client to slow down on the exercising and because an additional dose of the prescribed diuretic is needed? Well, that doesn't make sense. Remember that on the stem of the question it said that the patient didn't have edema. So we can take that part out. So B, let's call this A also. Or actually, let's make it so you don't get confused with the other ones. Let's make this D, E, and F. So we can take E out because it doesn't make sense to the stem of the question. So now we have either D or F. The nurse would advise the client to slow down on the exercising because, look at F, tolerance to increased activity needs to be built up and it takes time. So what sounds better? The nurse would advise the client to slow down on the exercising because their heart needs to contract efficiently. And exercise is one treatment to measure and accomplish this? No. Letter D would probably be more pertinent to answer B on option 1, but it doesn't make sense. So I can eliminate answer D, and the correct answer will be tolerance to increase activity needs to be built up and makes time. Tolerance to increase activity needs to be built up and it takes time. So as you can see, these questions can be slightly difficult because you have to make sense of it. When you analyze this question, it needs to make sense, but you always have to go back to what was described on the clinical scenario, and you can use that information to eliminate some of the answers. Okay? So this is an example of a drop-down rationale practice question. Now, as promised, we're gonna put everything together. So welcome to case study number 2, and we are gonna do 5 questions in this case study. Are you ready? Are you ready to begin? Are you ready to see this case study and judge yourself how you're doing? So what I want you to do, as we progress through the case study, I want you to write down the answers that you're getting correct and incorrect, because at the end, you're gonna have a total amount of points. I will tell you how many points each question is worth, okay? So we're gonna have 5 questions, and I will tell you how many points each question is valued, okay? All right, so let's begin. The case study says the following. The spouses brought, a spouse brought a client into the emergency department after finding a suicide note and the gun cabinet unlocked. Reports that the client is not the same person after being hospitalized 3 months ago with severe COVID-19 and mechanically ventilated for over 2 weeks. Client states that since being discharged from the hospital has periods of heart palpitation, insomnia, apathy, depressed moods, and anorexia. Reports that drinking alcohol every night helps to relax but still becomes anxious at times. is very worried about getting COVID again because the client's sibling, whom the client recently visited, tested positive yesterday. Has frequent nightmares about the hospital experience because the client nearly died, lost 35 pounds during the hospital stay, but states that he weighs more than 260 pounds now. Was considering suicide this evening because the client was afraid of possibly being reinfected and dying this time. Recently diagnosed with type 2 diabetes mellitus controlled by diet and metformin. Highlight the client's finding in the nurse's note that required immediate follow-up by the nurse. For the purpose of this presentation, I had to highlight some questions in black. What does that mean? On the NCLEX, when you do the highlight style of questions, when you hover a sentence, is going to mark for you the sentence that they want you to analyze, because they're going to give you some answers that are really important, some findings that need immediate follow-up, and they're going to give you some findings that, although they are important for the case study, you don't need to follow up immediately. So all of these answers that are highlighted, or I should say bolded in black, is important answers that you need to analyze. Now, out of everything that is bolded in black, I want you to tell me in the comment section what is immediately, or what needs to be immediately followed up on. I will give you 1 minute to analyze this, and I'll give you the answer. All right, so let's see what you determined. I see depression, heart palpitation, nightmares. Okay, so what can we eliminate? In other words, out of everything that is bolded in black, what is important but can be eliminated because I don't need to immediately follow up on? The first one is drinking alcohol every night. I can eliminate this one. Why? Because that is a modifiable risk factor. The patient needs teaching about the importance of not drinking, how drinking will affect different body systems, but I don't need to immediately follow up on that. The patient also is overweight, weighs now more than 260 pounds, 117 kilograms. That is important, but I don't need to immediately follow up on that. The patient has a history of type 2 diabetes mellitus. That is important, but I don't need to immediately follow up on that. So the rest of the information bolded in black, I need to immediately follow up on, which is the sentence that talks about heart palpitation, insomnia, apathy, depressed mood, and anorexia. All of these patients' symptoms I need to follow up on. Heart palpitation, I need to follow up on that. Insomnia, apathy, depressed mood, and anorexia. What other information I need to follow up on? Frequent nightmares. What is the relationship between frequent nightmares and the clinical scenario that they're giving you? Okay? Suicide this evening. That is extremely important to follow up because it deals with client safety. So, as you can see, this type of question, although it seems not too hard, can be very difficult. So, if you put heart palpitation, insomnia, apathy, depressed moods, and anorexia as your answer, that's 1 point. If you put frequent nightmares as the answer, that's 2 points. If you put suicide this evening as one of your answers, you got 3 points. So there is a total of 3 points in question number 1. Okay? Now, remember this case study, what is going on, because now the question number 2 is going to continue this scenario. So question number 2 relates to exactly the same scenario you just saw. Now it says, for each client assessment finding, click or indicate with an X which finding is associated with which client condition. Some findings may be consistent with more than one condition. So now you have to look at the client's findings in the left side of this table, on the left side of this table, and you gotta say, recent near-death experience. What does it apply, or where can I see this? Generalized anxiety, clinical depression, and PTSD. So comment in the comment section. Number 1, we're gonna say that recent near-death experience is number 1. Recent near-death experience, where would you put that? And comment 1, this, and that. Let me see your answers. Remember that it can apply to more than one. Okay? Remember that each one can apply to more than one. You have to read the instructions. Look at the second sentence. Some findings may be consistent with more than one condition. Because I see everyone selecting only PTSD. But you have to say if it applies to generalized anxiety, clinical depression, PTSD or not. So number 1 would be generalized anxiety, clinical depression, and also PTSD. So the client findings of recent near-death experience can apply to the 3 diagnoses: general anxiety, clinical depression, and PTSD. If you selected the 3 of them, you got 3 points there. If you only selected 1, then you only got 1 point. If you selected 2, 2 points, and so on. This is just for you to measure yourself, okay? Now let's go to the second one, anorexia. Where will you see anorexia? Generalized anxiety, clinical depression, or PTSD, or a mix of them. So anorexia, you will see it in generalized anxiety and clinical depression, but it's not frequently observed in PTSD. You see how it works? You see how the question works? Now let's go to depressed mood. Which condition does depressed mood apply? Generalized anxiety, clinical depression, or PTSD? Depressed mood will apply to clinical depression and PTSD. See? Apathy. Where does apathy apply to? It applies to, what is PTSD? Post-traumatic stress disorder. That's what PTSD means. Apathy will apply to clinical depression and PTSD. What does nightmare applies to? See, nightmare only applies to PTSD. What is this telling me? You see how question number 2 is kind of telling you what the possible diagnosis could be? Because we have something that the patient is experiencing that now only applies to PTSD. But we see a little bit of a competition between clinical depression and PTSD. So how about suicide risk? Well, suicide risk applies to clinical depression and PTSD. How about excessive worry? What do you think applies to excessive worry? This client finding, excessive worry. Generalized anxiety, clinical depression, or PTSD? Well, definitely generalized anxiety, but does it apply to clinical depression and PTSD? No. Insomnia. It applies to generalized anxiety, clinical depression, and PTSD. So we see in this question we have 3, 5, 7, 8, 9, 10, 16 points in this scenario. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So 16 points in this scenario. How many points did you get? Maybe you got 10. Maybe you got 8. But you got something. You see how good this is? It looks like super intimidating. It looks like, oh my God, it's so difficult. But even if you mess up somehow, you still get some points. Now, depending on which rule of points they're going to use for that question, it varies. I don't want to get into the point rules now, because sometimes they give you points per row. Sometimes they give you a point per each section. Sometimes they take points off. It depends, but that's not really important. What I want you to know is that no matter what, you get partial credit for the answers that you select correct. Okay? So far, we had 3 points in question 1, 16 points in question 2. Let's go to question 3. Says, at 23:30 hours, 11:30, this social worker interviewed the client who admitted to having flashbacks about hospitalizations and feels guilty about putting family through that experience. Patient states, was lazy and did not wear a mask or social distance at an important corporate meeting. As a result, the client developed COVID-19 infection, expressed remorse for upsetting the spouse, and apologized to her and the social worker. So now, the patient is experiencing some regrets about his demeanor, his carelessness. So we got some psychosocial issues going on here. Now, we're going to look at question number 3, and it's going to look very similar to what the style of question that we practiced earlier before beginning the case study. Remember this one? You have several options and you have to complete a sentence. The same thing, but now you have 3 options to select from. Now, here's the trick. In this question, I'm going to show you a trick. I want you to find first option 2. Then you will select option 1, and then you will select option 3. But notice that for option 1, there's only one option to select because it's only underlined once. The client most likely has one option in option 1 as the primary mental health condition, as evidenced by option 2 and option 2. It means you have to select 2 answers from option 2. And then the third option is the priority for the client care is to option 3. One answer in option 3. So, in other words, you have to select one answer here, 2 answers here, and 1 answer here. So I want you to begin with options for 2. It says, the client is most likely has option 1, something, a medical diagnosis, as the primary mental health condition is evidenced by option 2, 2 answers. So you have to look at these answers and you have to say, where can I see anorexia? Where can I see nightmares? And where can I see excessive worry? And where can I see flashback? If you recall the previous question, we already have the answer. Recall the previous question. Where did we put, for example, nightmares? We said nightmares was particularly for PTSD. So we have one symptom, clinical manifestation pointing towards PTSD. But also look at flashbacks. We talked that flashbacks was also a characteristic of PTSD. Voila, we got the answer. Because I need 2 answers in option 2 that points towards a diagnosis. Because anorexia and, for example, excessive worry, we only saw that applied to, it was, what was the first option? I can't remember. Generalized anxiety. Remember that? Excessive worry, it was generalized anxiety, which is not even an option now. So the only options in 2, nightmare and flashback, only points to PTSD. So now it's looking like this. The client most likely has PTSD as the primary mental health condition, evidenced by nightmares and flashback. So you have one diagnosis selected and two clinical manifestations. Now, if you already determined that PTSD is the diagnosis with the clinical manifestation or with the evidence of nightmares and flashback, what is the priority client care need? This is the part of taking action. You have to prioritize and take action. So what will you do if you have a patient with PTSD with nightmares and flashback? Now in here, you have to use a prioritization strategy. Oh, wow. Prioritization strategy. Why? Well, begin intensive counseling. That's psychosocial. Ensure personal safety. Well, that's safety. Start drug therapy. Which drug therapy? Refer to a spiritual advisor. That would be psychosocial. Now, remember the case scenario, what it was about? What did he say that the patient was discovered doing? The patient was discovered attempting to commit suicide and verbalized that wanted to commit suicide. Why? Because the patient has PTSD, as evidenced by nightmares and flashback. So if we have a patient that wanted to commit suicide, even had a weapon that wanted to commit suicide, is having all these clinical manifestations, if we use the Maslow's hierarchy of needs, what will be the priority nursing action? The priority nursing action will be to ensure personal safety. That is the answer. Okay? So in this question, there are a total of 1, 2, 3, 4 correct answers. So far we have 23 points in this case study. How did you do in this question? Did you select PTSD? Did you select nightmares and flashback? Did you select ensure personal safety? Let's say that you selected PTSD, nightmares and flashback, and you put drug therapy. That's fine. You got 3 out of 4 points. Not too bad. You see? All right. Let's go to the question number 4. This is a select all that apply. The client was diagnosed with PTSD, anxiety, and suicide risk. You see how the case study continues? And one question takes you to the next step. Which physician orders would the nurse anticipate for the client at this time? So based on this diagnosis, PTSD, anxiety, and risk for suicide, what orders do you anticipate from the doctor? So comment on the comment section if you think it's 1, 2, 3, 4, 5, 6, 7. Select all that apply. There could be more than one answer. Could be 1, could be 2, could be 3, could be all of them. Comment in the comment section what you think is the answer. So let's go one by one. Begin antidepressant drug therapy. Does that apply? Yes, the patient was diagnosed with anxiety, has clinical manifestations of depression as well. Because remember, a patient with PTSD can actually suffer from several of these mental illness conditions. So, will the patient need antidepressant drugs? Yes. Risk for suicide. So 1, I will select. Do I need to admit the patient to an acute psychiatric unit? Absolutely. If the patient wanted to commit suicide, the patient needs to be admitted. So 2, I will select. Does the patient need to be on one-to-one supervision? Absolutely. Patient wanted to commit suicide. 3, do I need to refer to a spiritual advisor? Well, that depends if the patient is spiritual. I don't know that. There was no information on the stem of the question on the clinical case study that would incline me towards this answer. So 4, I can eliminate. 5, voluntary admission orders. I hope nobody selected number 5. Because remember, a patient that wants to commit suicide will be admitted involuntarily. Involuntary admission. In Florida, we call it under the Baker Act. I don't know if it's the same in all the states, but it will be involuntary admission. So 5 is eliminated. Place on suicide precaution. Definitely, the patient is suicide risk. And number 7, allow any visitor to see the client. We see a very important keyword here, which is any. This is an absolute word, and this will be unsafe for the patient. So answer number 7 is eliminated. The correct answer is 1, 2, 3, and 6. So there is a total of 4 points in this question. So how did you do? 4 out of 4, 3 out of 4, 2 out of 4, 1 out of 4. And write it down. Let's go to question number 5, and this is the last question. A 56-year-old client was diagnosed with PTSD after being admitted to the ED, same scenario. Because the client's spouse found a suicide note and an unlocked gun cabinet, same information. After a thorough evaluation, the client was admitted for one-to-one observation in an acute inpatient psychiatric unit and started on sertraline and psychotherapy. So you see how the case study progresses. Now the patient is admitted one-to-one, acute inpatient psychiatric unit, new treatment started, sertraline and psychotherapy. The nurse plans health technique about the nurse plans health teaching, about the medication for the client and spouse before administering the first dose. So this question is about teaching. Teaching about what? Sertraline. Anytime they mention a medication, this is important. Now, this question is a select and selector that apply. What does that mean? We already discussed this. Select and means select a specific number of answers. In this scenario, there's only 5 possible correct answers because it says select 5 statements that the nurse would include in the health teaching about sertraline. So there are 7 options, but only 5 options are correct. So let's go one by one and you tell me if it applies or doesn't apply. Number 1, this drug is one of the most effective ways to treat PTSD and depression. Well, this is correct. This is a true statement. Sertraline is a selective serotonin reuptake inhibitor. It's an SSRI. Very effective in managing clinical depression and PTSD. Number 2, we will be monitoring you for sedation effect while you're here. Well, this medication does not cause sedation. Side effect could be insomnia, nervousness, agitation, but no sedation. So 2 doesn't apply. We can eliminate. 3, let me know if you have trouble urinating or having a bowel movement. It doesn't cause this side effect either. So 3, I can eliminate. So you can see that this is a pharmacology question. Let me know if you have trouble sleeping or feeling nervous while on this drug? Well, we know that the side effect could be insomnia and nervousness. So answer number 4, it will be an appropriate answer. 5, we will be monitoring you carefully for changes in your vital signs. Well, I think that that's important for any patient taking a new medication. Because remember, it says the first dose. So it doesn't really matter if it's sertraline or it's any other medication. If it's the first time we're starting a brand new treatment, we have to monitor those vital signs. So number 5 is important. Remember that one of the adverse effects that a patient could manifest by taking sertraline is serotonin syndrome, which is an emergency. So we have to monitor the patient. You might experience mild nausea and feel agitated when taking or starting this drug. Definitely 6 is one of the side effects. And number 7, your liver and kidney function will need to be monitored. Well, you have to look here if this medication can cause any liver or hepatotoxicity, liver or kidney toxicity, hepatotoxicity or nephrotoxicity, and of course, it will be an appropriate laboratory to monitor. So answer 7 is a correct answer. So I hope you got the 5 answers correct for a total of 5 points in here. So in this whole scenario, from question 1 to question 5, you have a total of 3 on the first question, 16 on the second question, that's 19, 23, 27, 32. I think I got total 32 points. 16, 19, 23, 27, 32. So 32 total points. Now, add up all your points and let me know in the comment section, how did you do? Hope maybe somebody got 32 out of 32. Congratulations. 31 out of 32, 30 out of 32, 28, 27, 25, 20 out of 32, 15 out of 32. What did you get? Let me know in the comment section. Dino, 28 out of 32, excellent. Cheryl, 21 out of 32, not bad. Jim, 28, 28, 27, 28. All of those are passed, guys. You passed the clinical scenario. You see how even though in certain questions you could have been a little bit thrown off, maybe you didn't remember something specifically, but in general, you were able to manage through the case study. So do you see how everything we've mentioned from day 1 to now, day 6, helps you improve your critical thinking? Did you ever thought that coming to this 7-day training, your clinical judgment and your critical thinking was going to change that much? What do you think? Have you liked this training so far? Do you enjoy it? Do you see it as a benefit to you, to your family? Let me know in the comment section. Remember, like this video, subscribe to our channel if you haven't done so, and share this training, guys, with everyone. Okay? All right. To conclude, let's go to the free access to our 3 candidates. I've already talked about what's included in the membership. You know that it includes 2 live classes on Zoom. So let's select the 3 candidates. Okay, candidate number 1 is, let's see. Sonia Morales from USA, Kissimmee, Florida. Wow, we got some Floridian here. Sonia Morales, congratulations, Sonia. Let's select number 2. Victor Alarcon from Mexico. Oh, we got some Latinos here. Good job. Number 3. Sinju from India. Congratulations, Sinju from India. All right, guys, that is it. Thank you very much for being here. See you tomorrow on the last day of this 7-day training. Do not miss it for anything. We're going to talk about a very interesting case study. We're going to continue putting everything together. So it's going to be another opportunity to improve your clinical judgment, to improve your critical thinking, and continue learning strategies. That is it for me today, guys. God bless you and your family. Bye-bye. Blessings.